Your penis is shrinking day by day. But no one ever told you that. There's no pain, no swelling, no bleeding, and no warning sign. It just quietly retracts, little by little, until one day you realize it's no longer what it used to be. And it all begins with one thing that seems harmless. You stop touching yourself. I'm a urologist, 30 years in this field, and I've seen hundreds of healthy men, no disease, no trauma, come into my office with the same shock. I don't understand. I haven't done anything, but it's getting smaller. Exactly. You haven't done anything. And that's the problem. You see, your penis is not just a lump of flesh placed there and forgotten. It's a living system of tissue, muscle, nerves, and blood vessels. It survives on circulation. It reacts to stimulation. It responds to signals from your brain. When you were younger, regular sexual activity kept everything running. But after 60, as intimacy slows down, many men decide to give it all up. They stop touching. They stop masturbating. They stop connecting. You think you're being morally stronger. But in reality, you're abandoning a part of your masculine identity. I'm not saying you have to masturbate to survive. But if you want to remain a man, you cannot let that part of you die. The scariest part isn't the shrinking. It's that you don't feel it happening. Because penile atrophy doesn't strike overnight. It creeps in silently. When blood stops flowing regularly. When the tissue isn't exercised. When your brain forgets how to send arousal signals. And when you no longer care enough to protect it. Don't let the day come when you look down and no longer recognize yourself. Because if you wait too long, there is no pill that will bring back what you silently abandoned. The truth, your penis can shrink over time. Most men have no idea this can happen. No one talks about it. And by the time you realize it's happening, it may already be too late. But I'm going to tell you now directly as a doctor, no soft language. Your penis can slowly shrink over time. Even if you don't have any disease. Even if you've never had surgery, injury, or any trauma. Even if you're perfectly healthy. There's a medical name for this, penile atrophy. It's real. And it's more common than you think. I've seen it in men aged 60 to 75. Coming into my clinic asking why they've lost morning erections. Why their penis feels smaller, softer, or weaker than before. When I ask them, do you still have sex? Do you masturbate? When was the last time you really felt alive in your own body? The answer is usually the same. It's been a long time. I thought at this age, I should let it go. That thought, that letting go is natural, is the exact reason why the penile tissue starts shrinking, hardening, and losing elasticity. So what exactly is happening? The erectile tissues in your penis, called the corpora cavernosa, are not just there for appearance. They are muscular vascular chambers designed to expand with blood. But like any other muscle or tissue in your body, they need to be activated regularly to stay functional. When weeks or months go by without stimulation, blood flow slows. Capillaries harden. Elastic muscle fibers are replaced by rigid connective tissue. The body begins reabsorbing parts of the tissue that aren't being used. This is not theory. This is basic male physiology. One study from Boston University found that men over 60 who ejaculated less than once per month had more than twice the risk of losing spontaneous erections, suffering from measurable penile shrinkage, and experiencing reduced flexibility of the erectile tissue. The worst part? It happens silently. No pain. No warning. Just that feeling that something isn't right anymore. Until one day you pick up a mirror, and it's visibly smaller than it was just a few years ago. The most common signs include loss of morning erections. You used to wake up with spontaneous firmness. Now nothing. Reduced size and softness. It's not belly fat. It's a real reduction in length, up to 1 to 3 centimeters. Loss of elasticity. It feels lifeless. Not responsive. Colder. Less resilient. You don't lose your manhood overnight. You lose it millimeter by millimeter. Because you stop touching yourself. This is not the end. But it is a warning. If you're in your 60s and believe that giving up all sexual activity is the right path, then you're quietly allowing one of your most vital organs to disappear. Not with a bang, but quietly, bit by bit, like an abandoned house crumbling brick by brick. And by the time you finally notice, it may be too late to rebuild the foundation. The cause? You stop touching yourself. After turning 60, many men simply disconnect from their bodies. They stop having sex. They stop masturbating. They stop even thinking about it. And when asked why, the answer is often, "At this age, I thought I shouldn't anymore. I want to stay clean, avoid temptation. I'm too old for that kind of thing." It sounds noble. It sounds moral. But as a urologist, someone who understands how the body truly works, I'll tell you this bluntly. When you stop touching yourself, you're not just giving up a habit. You're cutting off a vital signal between your brain and your sexual organs. The penis, when unused, is forgotten. The human body is designed to prioritize what's used frequently. And just as importantly, it lets go of what is no longer active. When a part of your body isn't moving, isn't stimulated, isn't receiving blood flow, the body begins to reabsorb or harden that tissue. That's why people who are bedridden for months lose muscle. Because the brain stops sending movement signals, the muscle atrophies. The same happens with your penis. When you completely stop touching it, even just a few times per month, the brain stops sending signals. Nerves lose sensitivity. Blood vessels shrink. Erectile tissue loses elasticity. And eventually, it leads to irreversible shrinkage. Testosterone and the body's shutdown response. Did you know part of your testosterone production is linked to sexual stimulation? Even mild arousal without orgasm tells your body this function is still needed. Your hypothalamus, pituitary gland, and testicles stay engaged. Testosterone production continues. Your energy stays stable. You feel alive. But when you shut everything down, your body thinks, he no longer needs this system. So the hormonal axis slows down. Testosterone drops. Your energy drops. Your drive disappears. And everything starts to feel numb. I'm not saying you must masturbate to survive. But if you want to stay a man, you can't let that part of you die. This isn't about lust. It's about connection. Many men mistake masturbation for something dirty or impulsive. At this age, it feels embarrassing, even weak. But the truth is, after 60, masturbation is no longer about satisfaction. It's about keeping your body alive. It's about touching, not to climax, but to tell your body, I'm still here. I still care. I haven't forgotten you. Just a few minutes, a few times a week is enough to keep the brain-body signal alive, maintain blood flow, preserve erectile tissue, and protect your nerve sensitivity. You don't have to do it out of desire. You just have to do it for life. I once had a 71-year-old patient, single, living alone. He avoided touching himself for 6 full years. By the time he came in, he had no morning erections. No sensation. His penis had shrunk by over an inch. But what devastated him most wasn't the size. It was the feeling. I let that part of me die, and I didn't even notice. You're still thinking, this doesn't apply to me. I'm too old. Then let me remind you, no one is too old to stay connected with their own body. You don't need to be intense. Just begin with a small gesture. A few minutes. No pressure. No guilt. Just presence. A silent hello. A signal to your body. I'm still here. Clinical reality. What I saw in my patients. I'm not saying this because of theory. I'm saying it because I've seen it hundreds of times in my clinic. And today I want to show you the clearest contrast I've witnessed over the years. 2 groups of men over the age of 60. Group 1. Men who still masturbate gently and regularly. On average, they do it once or twice per week. Not because of lust. Not because they're addicted. but because they understand it's part of being alive. They don't avoid their feelings. They're not ashamed of their bodies. They don't rely on strong visual stimulation. They simply stay connected. They touch themselves when their body needs it. No pressure. No guilt. After 6 months to 2 years of follow-up, here's what I observed. Morning erections still present. Penile tissue remained elastic and full. No shrinkage. Testosterone stayed within healthy range, without medication. Better sleep. Steadier moods. And most importantly, they still had confidence. A quiet flame that never went out. I asked one of them, a 69-year-old widower, "Why do you keep up this habit?" He smiled and said, "Because I don't want to forget who I am." Group 2. Men who stopped completely, often due to shame, trauma, or belief. When asked when they last touched themselves, most answered, 10 years ago. I don't remember. My wife passed and I never felt the urge again. At this age it just felt wrong. They came to me because of noticeable shrinkage of the penis, between 1 and 3 centimeters. No spontaneous erections anymore. Numbness. Coldness. Loss of sensation even to touch. Drastically lowered testosterone. Shallow sleep. Emotional dullness. They weren't depressed in the clinical sense, but there was a quiet emptiness in their presence. One man, 74, a retired engineer, told me, "I stopped everything when my wife died. I didn't touch myself, didn't think about it, and one day, I realized I couldn't feel anything, and I got scared." What I learned, clinically and humanly, same age, same health history, same living situation, but just one small difference. Did they still touch themselves even once a week? That single habit created 2 completely different realities. Men who stayed connected to their bodies kept their size, their natural erection reflex, their sensitivity, stable testosterone levels, better sleep, a sense of being whole. Men who disconnected completely lost size, spontaneity, sensation, vital hormones, and a silent part of themselves they couldn't name. A man who still touches himself, even just once a week, doesn't just hold on to sensation. He holds on to himself. This isn't about morals. This isn't advice for everyone. This is a quiet truth. From years of seeing real men, wrestling with a question no one dares to ask out loud. Am I still a man? The answer doesn't lie in pills, or surgeries, or supplements. It lies in a tiny habit, a silent act, that protects something no doctor can restore. The feeling of being yourself. How to keep it from disappearing. After more than 30 years as a urologist, there's one question older men have asked me over and over again. Usually in a quiet voice, but with eyes full of urgency. What can I do to keep it? To make sure it doesn't vanish like I've seen in so many others. And every time, I don't hand them a pill. I don't promise a miracle. I simply say, stay connected. Even just a little. Even once a week. Your body will understand and respond. 1. Masturbate regularly but gently. 1 to 2 times per week. You don't need to do it often. You don't need to force anything. But you do need to be consistent. Just like you move your legs so they don't weaken. You must engage the tissue in your pelvis, because your penis is still living tissue. Still full of vessels, nerves, and smooth muscle. When you masturbate, you activate the sexual nervous system. Blood flows to the penis. Tissue expands. The brain and genitals reconnect. Testosterone rises slightly. Not like in your 20s, but enough to remind your body, this part of me still matters. Even once per week is enough to keep the system alive. 2. Morning is the best time. Testosterone is highest in the morning. Your mind is calmer. There's no stress from work, bills, or news. You're more in tune with yourself. This is the best time to reconnect. Not for pleasure, but for presence. You don't need a fantasy. You don't need a screen. Just breathing. A gentle touch. A few minutes of remembering, I'm still here. 3. You don't need to climax. You need circulation. This is vital. Too many men think that if they don't orgasm, it's pointless. That's wrong. After 60, your goal isn't explosive pleasure. It's preservation. What matters is blood flow, neural activation, elasticity of the tissue, sensitivity of the skin, a living, responsive connection between your brain and your manhood. Just a few minutes, no rush, no pressure. Think of it as caring for a part of you that the world forgot. Combine it with natural support for your manhood. Kegel exercises. Tighten your pelvic floor for 5 to 10 seconds. Exhale. Relax. Repeat 10 to 15 times a day. This strengthens your control over urination and supports erections. Gentle squats. Hold for 10 to 15 seconds. Boosts circulation in the pelvic region, where your entire sexual system lives. Deep breathing, meditation, groin massage. These relax your nervous system, allowing more blood to reach the genitals. Avoid tight underwear at night. Let the area breathe and stay healthy. You don't need to change everything overnight. Just start gently. One thing at a time. Don't do it like when you were 30. At 60, every time you touch yourself is a way to heal yourself. Don't do it for pleasure. Do it for connection. Do it as if you're protecting something sacred. You don't have to explain it. You don't have to share it. It's just you and your body, remembering that you're still one. And yes, after a few weeks, you may feel warmth return to your penis. Slight firmness, sensation, deeper sleep, a clearer mood, a spark of aliveness you hadn't felt in years. If you're thinking, I haven't done this in a long time, maybe it's too late. Let me say this as someone who's seen too much. Not touching yourself doesn't make you holier. It just makes you disappear from yourself. You don't need to perform. You just need to say hello. Gently, kindly. Like asking, are you still there? Because every time you touch yourself, even if there's no climax, you're telling your body, I haven't forgotten you. I still care. I'm still a man. True story, a 72-year-old man. I will never forget him. A 72-year-old man walking into my office on a quiet March morning. His eyes said what his words couldn't. He hadn't lost his mind, or his heart, or his ability to walk. But something deeper had faded. He didn't have cancer, no heart disease, no diabetes. But his voice was tired, his posture slightly bent. And the first thing he told me was, I don't feel anything down there, doctor. Not pain, not arousal, not even warmth. It just doesn't feel like a part of me anymore. I asked how long it had been since he touched himself. He looked down, silent for a few seconds. Then, like a confession, he said, I think more than 5 years. After my wife passed, I thought I shouldn't do it anymore. I thought it was the respectful thing to do. But then the symptoms came. Frequent urination at night. His penis grew smaller, softer, colder. No more spontaneous erections. Even in the mornings. Sleep became shallow. His emotions flattened. Not sadness. Not depression. Just nothingness. I ran tests. Nothing alarming. No medical red flags. Only one undeniable truth. His body had stopped receiving signals from himself. I gently suggested he try something. No drugs. No devices. Just this. Touch yourself once a week. No goal. No climax required. Just connection. 5 minutes. That's it. The first week he said it felt strange. By the second week the fear faded. By week 4 something happened. He woke up one morning and felt warmth in his groin. Not much, but enough. By the second month he was sleeping deeper. Dreaming again. Soft, simple dreams. The kind he hadn't had in years. Each morning he sat on the edge of his bed, placed a hand on his lower belly, and whispered, I'm still here. Month 3, his penis began to stiffen during urination. Not full erections, but life. He smiled for the first time in months. A small, trembling smile. But real. By the 4th month he returned to my office. I asked, "How are you feeling now?" He didn't answer at first. Then his eyes filled. He cried. Not from pain. Not from shame. But from realization. It's been 5 years since I felt anything real in my body. And now, I'm back. Not everyone can say that. Not every man has the courage to reconnect. After years of silence. But he did. And his body answered. Not with loud signs. But with warmth. Sensation. And the quiet return of life. You don't need to wait 5 years. You don't need to lose yourself to come back. Sometimes all it takes is one touch a week. One gesture. One whisper. Are you still there? And if you listen closely enough, your body will whisper back. I've been waiting. Welcome home. So, after everything you've just heard, I want to leave you with one simple truth. Penis shrinkage is real. Not hypothetical. Not rare. And not reserved for other men. If you do nothing, if you stop sending signals, your body will respond with silence. And in this case, silence doesn't mean peace. It means loss. You don't need to masturbate every day. You don't need to do it like you did in your 30s. And you certainly don't need to feel ashamed if your body doesn't respond like it used to. But what you do need is understanding. Understand this. Your body, yes, even at 60, 70, or 80, still wants to feel alive. And your genitals are not just organs. They're a part of your emotional memory, your instinct, your identity. I'm not here to tell you what's right or wrong. I'm not preaching. I'm just sharing what decades of medical practice and the quiet truths of thousands of men have shown me. When you stop touching yourself, you're not becoming cleaner. You're simply letting a part of you slowly disappear. Maybe you're thinking it's too late, but it's not. It only takes one small act, a touch, a breath, once a week, and you've done something very few men dare to do at this age. Preserve their manhood. You don't need to tell anyone. You don't need to explain. But your body will know. And yes, silence can be sacred. But be careful. If the silence comes from disconnection, it might be your body's first cry for help. Now, if you're still masturbating regularly, I'm genuinely happy for you. That means you're still connected, still feeling, still alive. But I'll be honest, sometimes you can do the right thing, the wrong way. Too much stimulation, too much dopamine, too much pressure on your nervous system. That's why the next video is absolutely essential. Masturbation after 60. 3 signs you're doing it too much. We'll break down what is too much, how to recognize it, and most importantly, how to adjust before your body pushes back. I know this is a sensitive topic, but if you've made it this far, I believe you're ready. Ready to face this part of aging. With honesty, with wisdom, with the strength of a man who refuses to disappear. See you in the next video. And remember, your body doesn't need perfection. It just needs your presence.